Good evening, everybody. Welcome to HEALTHline. I am Gregory and Susanne.
And I'm Judy Van Houten. In this episode, we are going to be talking about staying healthy in the workplace and also helping workers stay healthy when they're off the clock as well.
Okay, so I have a riddle me this. How do you, because I love my riddle me this, how do you stay healthy in the workplace?
Well, first of all, lots of hand washing. We're big on hand washing here on this show.
Sneezing in your elbow. Oh,
that's sneezing
right
in the
there,
elbow.
right.
But also avoiding hazards. In my job, there's lots of cords strung all over the place and lots of equipment hanging around, and and there's ergonomics too that are practiced in my other workplace, and so that's part of staying healthy on the job. But there's also a conscientiousness component as well. You want to be able to, if you have a disease such as diabetes, you want to make it manageable, and there is a department at Glendale Adventist Medical Center that is available to help. They provide screenings, guidelines, treatment, and diagnosis of problems that crop up related to the workplace.
And they also share with you healthy ways to stay healthy. So joining us tonight is the director of the Occupational Medicine Center from Glendale Adventist Medical Center, Judy Van Houten.
And the medical director is Matthew Chan. Dr. Chan, welcome.
Thank you.
Judy, welcome.
Welcome, both of you. Talk to us about the why, the how, and the what of the Occupational Center.
The why, the how, and the what, indeed. I think it's important that we explain exactly why we do what we do at the outset. And I think one way to answer that would be to give you my personal mantra, my personal mission in tackling and engaging occupational medicine. And that can be summarized in this simple phrase: work healthy, live well. And how would be simply, we take care of employees' health needs, whether it be prevention, screening, injury treatment, and so forth. And what are the services we provide? Essentially, workers' compensation care for acute injuries. We provide screening exams for pre-placements for corporations and employers in the community that are hiring new people on the job. And we also provide surveillance for government agencies like the fire department, the police department, and various cities. And we're also looking to expand services to include other things like executive wellness, employee wellness programs, more comprehensive prevention screenings, and so forth. And there's even talk of perhaps expanding out and doing a travel clinic for people who travel on business overseas.
Now hold that thought, doctor, because I love always a great cliffhanger. Yeah. And I also want to know what your why is about why you do what you do as well, Judy. When we come back, we're going to find out more about what occupational medicine is, and we're going to share with you the how and the what. Do not go away.
I'm Judy Van Houten, and this is my health tip. Not all workaholics are created equal. You think you know the sort, the guy or the gal who works 70, 80 hours a week, and they tote their BlackBerry or their laptop to the beach during that 1 week of vacation that their family forces them to go on every year. Well, Dutch researchers divided the productive workforce into 3 categories. First, there are engaged workers, and they're loyal and they're reasonably productive and hardworking. Next is the social workaholic, and that's the person who is motivated either through social rewards or through the fear of bad consequences to become a workaholic. And then there is the engaged workaholic, and they are the people who are working hard because, well, they enjoy their job. What's the difference? Burnout. The engaged workers don't burn out as quickly because they're jazzed about their job. Now, you know, everybody wants to have a productive life, but nobody ever lies on their deathbed wishing that they had spent more time at the office. The fact is, you are replaceable at work, but you're irreplaceable to your family and to your social circle. I'm Judy Van Houten, and that's my health tip.
Hi, are you a member of Facebook? You know, I am, because I like to know all that my friends and family are doing. Wait, did you know that HEALTHline has its very own Facebook page? All you got to do is go to Facebook, type in HEALTHline, find us, click like, and become part of the conversation about health, lifestyle, and the community. We post links, health tips, suggestions from you, the community, about what you do to lose weight, de-stress, have a happy, healthy lifestyle. Okay, once again, all you gotta do is go to Facebook, type in HEALTHline, and become part of the conversation. Hold on. Okay, somebody just posted that if you drink an 8-ounce glass of warm water with lemon, it starts to invigorate your metabolism. Oh, along with jumping up and down for 60 seconds first thing in the morning. Okay, you know what? I've got to pass this on. Become part of the HEALTHline conversation. We will see you on Facebook.
Here on HealthLine, we are talking about occupational medicine. Just what is that? Well, we're going to find out more from the director and from the new medical director of the Occupational Medicine Center at Glendale Adventist Medical Center. Judy Van Houten, the director, the new medical director, Dr. Matthew Chan. And Judy, tell us a bit about your role there at the facility. You're at the clinic, which is about 3 miles or so from the hospital campus?
That's correct. I serve as the administrator of the center. And we have a staff of about 20 people that do a variety of things, including everything from registration all the way through the billing and collection process. We draw blood, we take x-rays, we do whatever is necessary to take care of the patients that walk through our door. And part of our job is to do it quickly and efficiently, and it's the services are all very much targeted to a specific reason for their visit at the center, for a physical, for a drug test, for a work-related accident or injury.
So then bringing it back to my cliffhanger, the how and the what, that all comes into play then, right, Doctor?
Indeed, yes. And Judy does an excellent job of managing the staff, and they're a very efficient staff, and I must say that's probably one of the best staff I've ever had the privilege of working with. And getting patients in and out is a challenge sometimes in workers' compensation cases, which represents the vast majority of the patients that we see, because oftentimes they're under pressure to get back to work as soon as possible. The supervisors are watching the clock because they're all about productivity and making sure their workers are getting back in a healthy way, in a safe way. So the staff there is outstanding.
So then you just don't deal with staff at the hospital. I mean, the clients from the hospital, you deal with the entire community.
Absolutely.
Can you talk a little bit more about that, Judy?
Well, certainly the medical center is a client that is very near and dear to our hearts, but we take care of employers of all shapes and sizes from the city of Glendale, lots of different retail stores, grocery stores, all the way down to the single owner operator cab driver or a gas station owner, 7-Eleven, and everything in between.
Does every business have to have a contact like you?
They should.
They should. Okay, they should. So if you don't have a Judy and a Dr. Chan, please call us. We'll help you out here.
Give us some examples of why occupational medicine is different from medicine that's just practiced in a doctor's office.
Dr. Chan?
Okay, sure. Well, I think we can differentiate occupational medicine on a variety of levels. And first of all, from a clinical standpoint, I would say that you're dealing with a lot of primary care issues with a focus of musculoskeletal care. So you can think of us from a clinical perspective more along the lines of an orthopedic surgeon that doesn't do surgery, and perhaps maybe a physical medicine rehabilitation doctor that does also some primary care stuff like infection control, and we even treat stress cases, psychiatric cases, and things like that. So on the clinical level, I would say it's a lot of primary care. And then on the other side, we deal with a select population. So from a public health standpoint, we deal with a very specific population, that being employees, workers. So if you are injured on the job, or another way to look at it is we deal with health problems that arise from work and work problems that arise from health. And so that's one way of looking at occupational medicine and its distinction from other medical specialties.
So then they basically complement each other.
Up next, we're going to be talking to our guests about their vision for a healthier population. So stay with us here on HealthLine.